I want to welcome everybody tonight to Lakewood Health Systems Glad You Asked live chat. My name is Matt Jensen. I'm the Director of Marketing here at Lakewood, and tonight we are going to be talking about advanced care planning. I am joined by two very special guests who are with me tonight. Both are social workers at Lakewood Health System. They're going to dive into this topic with me tonight. I'm here with Lindsay, Kirk, and also Jennifer, Kane. So welcome, both of you. Thanks for joining me tonight.
Thanks, Matt.
Absolutely. Good to have you with me. I appreciate you being here. And I want to let anybody know, if you're out there listening tonight, if you've got questions during the chat, feel free. I'll try to monitor those, and I can throw them to Lindsay and Jennifer as well as we kind of go through this. So let me just start off a little bit. I want to hear from both of you, find out a little bit more. Tell us a little bit more about you, your role here at Lakewood Health System, maybe how long you've been with us, and sort of your connection to this topic specifically tonight. So Lindsay, if you wouldn't mind, kind of start us off and tell us more about you.
Sure. My name is Lindsay Kirk, and I've been a social worker at Lakewood for 8 years this month. And my role is mainly in hospice and palliative care, working with patients in those programs and their families. And advanced care planning has been a passion for a long time for me, just getting people information, realizing how important it is, and helping them complete the forms.
Okay, fantastic. Thanks for being with us again tonight. Jennifer, same question for you. Tell us a little bit more about you.
I've been working with Lakewood in the role of palliative care social worker for a little over a year now. I also help out in the clinic and assist in the hospital as needed.
Got it. All right. Perfect. Thank you so much. So we wanted to just a little bit of background. November is actually National Hospice and Palliative Care Month. And it was interesting. This topic was brought to me, and they said one of the greatest gifts that we can give our family is the gift of advanced care planning, and sort of spurred this conversation tonight. And so we're going to talk a little bit about that. I found when I was researching the topic a little bit, ladies, there's some interesting things that jumped out at me, and I just think it frames this conversation really well. So just give me 1 second. It talks about this idea of courageous conversations. And maybe this is something that is a normal part of the vernacular and the things that you use with patients all the time, but it's a really tricky topic to kind of dig into, because I think we live in a culture that sometimes teaches us to resist mortality. Death is scary, right? We don't want to talk about it. It's frightening. And rightly so. It is a scary thing to think about, but what seemingly is a simple act of just having a conversation can be extremely difficult, whether it's an elderly parent, whether it's kids, bringing it to a mom or dad, that sort of a thing. It's very scary. But if we're able to have those conversations, they can be extremely profound and extremely beneficial. And I think, is that accurate in terms of how it's kind of laid out?
Yeah, very much.
I would agree.
Okay. And then there was a little piece of information I found too that I thought was really profound. And if you think about this from your own perspective, it says, what does death mean in my life? If I'm faced with a terminal diagnosis, how would my values shape my end of life journey? How do I want my loved ones to engage with me towards the end of my life? It's difficult to think about these questions, but having the courageous conversations with ourselves, our family, our friends, and doctors can mean the difference between having the type of death a patient wants, which even seems crazy to think about, or one that perhaps we maybe don't have a say in terms of our end of life journey. And so that's kind of what we're talking about tonight. And so to kick it off, I want to jump right into it, dig into this a little bit deeper. It really all starts with what we call a healthcare directive. And so I'm going to turn that over to, I'll let either of you tackle that. Tell us a little bit about what is a healthcare directive.
I'll jump into that one. So a healthcare directive is simply a form that outlines what your healthcare wishes are or would be if you were unable to speak for yourself. So it's really important, like you said, to have those discussions with your family and your friends so that they kind of have an idea of what's important to you and what your wishes are. And the form you can get as detailed as you want, or keep it more simple if you're younger and healthy and don't have a lot going on. But you really want to think about who would be that person that would make medical decisions for you if something happened and you couldn't speak for yourself. Think about who would be the best person to do that, to make difficult decisions and to follow what your wishes are and not their own. It's not always the first person that pops into your head, but give that some thought. And then if you have questions about medical treatments, definitely talk to your doctor and clarify what some of those treatments are and in terms of your own health conditions.
Got it. It makes perfect, it makes so much sense, doesn't it? Right?
Mm-hmm.
And yet it's one of those things that I think we all have some hesitation with and maybe would struggle with a little bit too. So Jennifer, for you, so like who should be completing a healthcare directive? Like I think of a couple of different audiences, but let us know like who's the type of person that should be thinking about this and when potentially.
Sure. We actually encourage anyone who's 18 or older, any adult, to complete a healthcare directive. And like Lindsay had mentioned before, there's for different stages of different lives, there's a form that can fit that. So we have a shorter form, one that's for one who maybe is younger, doesn't have a lot of health concerns, but still, it's still important to have somebody to speak for you if for any reason you can't. We can't foretell the future. There's always a chance that something will happen unexpectedly, and we just want to be prepared for that. So the short form just helps assign somebody to speak on your behalf. Somebody like Lindsay had said that would speak for you. So you want to think carefully about who you would choose for that. There's another form, a longer form that really kind of goes into more detail for those who are maybe approaching certain diagnoses or certain challenges with their health, where they have certain things that they would be amenable to and other things that they really don't want to have in their healthcare plan, or don't, certain treatments or interventions that they don't want to see happen. This is the perfect document for explaining that and stating your wishes so that they're known if you ever can't speak. And we'll get into that a little bit more too.
Okay, got it. So you talk a little bit about young and healthy. Great idea. Even, we may think we're invincible, we're young, we're healthy, we don't have any issues right now, but still it's always worth the precaution of taking the time to do that. And then also maybe getting up there in years, starting to have a few more health problems as well too, thinking about maybe the family that you're going to be potentially leaving behind, hopefully at somewhere long into the future. But again, just having those conversations as well. Do either of you have any suggestions? I'll be honest, it's one of the conversations that I've been looking to have with my own parents. They're both in their 70s. We're getting to that point in our life where I know that they have plans. I just don't know much about them, and I'd like to know more about them. Like, are there sort of conversation starters that you guys have or can offer people as suggestions on maybe how to broach that conversation with an older parent, for instance?
Jenny, do you want to take that one or me?
Sure, I can answer that one.
Yeah.
I recently actually had to go through this with my own parents. So, obviously there's certain times where diagnoses, if something comes up, something unexpected that can be talked about, it's a good time to discuss, what would you like to see? What's important to you? I would encourage everyone to review the document. I think in there, if you really look through and read it, it's based a lot on values and beliefs that can be had in just ordinary conversations that can kind of just lead into other things, watching a television show and seeing something happen there. And what would you do in that situation? Is that something, what do you think about this? TV, different topics being brought up like that can be a good conversation starter for that. Otherwise, just, bringing up your own experiences or those that you hear of others when other families are experiencing things, it kind of brings to light things that we don't always think about. And that can be another good conversation starter. Do you have anything to add, Lynn?
I think, this time of year we're gathering with families. I mean, it might not seem like the best conversation that you want to have during the holidays, but
Right.
It is a good time to maybe, after all of the celebrations are done, find a time to just say, hey, I've been thinking about this, what do you think? Or maybe you don't want to do that now, but you set aside a time to do that with your loved ones.
Right. Maybe find a time after the eggnog and the presents are open, right?
Yeah.
Okay, got it. Yeah, right. No, I think that's great. Great suggestions, great tips on just how to broach the subject. I think that's always the hardest part. Just getting the conversation started, getting the ball rolling typically is always the hardest part. So sort of break it down for us, ladies. When and how can someone complete a healthcare directive? I know I get asked that at every appointment that I'm at, whether it's a physical or do you have a healthcare directive? And by the way, I don't, so I need to get on that. And so this is a great conversation for me. But how can you get started? What's the process? Can I take care of this while I'm here? Do I need to bring it home? Maybe walk us through that a little bit too.
Lindsay?
Well, I can tell you, I'm going to speak a little bit more to why you should complete one. Like you said, it's a gift that you can give your family just to take the guesswork out in case there is an emergency. As you know, it's hard to make those decisions in the heat of the moment. So if you have a form that you can look back to and say, you know, this is what Dad said he wanted, it really takes the stress and the pressure off the rest of the family to be able to look at that and say, this is what he wanted or he didn't want this. It really takes out that stress piece, and it gives you a voice when you maybe don't have a voice in your healthcare to say what your wishes are. So,
yeah, no, absolutely. I completely agree. It's a great way to have your wishes followed through with and kind of have a plan, right? Have a plan before anything unfortunate were to happen. So, in terms of the other question, how they get started, something that when they can complete that, any advice on that? I want a patient, if they say, you know, this is something I need to do, like what's the next steps should they take at this point?
Sure. I think a lot of times at most medical facilities or hospitals or clinics will have documents that you can review and fill out. Another place is, you know, like you mentioned, Matt, bringing it up at your doctor's appointments. Just say, hey, I'm thinking about this. Can I review the document? That way you can ask your doctor any questions that you might have regarding some of the treatments or interventions, especially on that long form. You can always call and ask for social services. We can certainly get the forms to you if you don't have any appointments coming up or anything like that, but are interested. We also have documents available on the website. So if you go to lakewoodhealthsystem.com, you can go on there under patients and look for the documents as well there.
Fantastic. So a great resource is just obviously your provider as well, and then sitting down and having these conversations with them. Are there ever instances where the two of you are available, or either of you, to sit down and have the conversation as well, just to guide a little bit?
Yep, absolutely.
Anytime.
All right, fantastic. Well, I think that sort of wraps up our questions for the night. Great conversation. Great tips and suggestions here, especially right around the holiday season. As you said, we're getting together with family. It's some great time to maybe start some of those conversations and give it some thought. So I'm going to look through here quickly, see if we have any questions that came in on the chat really quickly before we wrap up. I don't believe we do. Ladies, I want to thank you again for your time tonight and for the conversation. Great topic. And great information for people to know. So have a great night.
Thank you.
Thank you so much.
You too.
All right. Take care.